We're almost done. Okay, documentation, your favorite part. So in this, you want to talk about the type of traction. So is it mechanical? Is it manual? Is it intermittent? Is it static? Is it pelvic traction? Is it cervical traction? So that's what we mean by type of traction. The area body where your traction is applied. So we already just talked about the cervical versus the pelvics. Their position, and that would include supine with their legs at 90-90 versus supine. The type of halter, if one is used. Under patient's position, I want you to include the angle. So if in the cervical spine, is it higher versus lower. You're going to also do the maximum minimum force, the hold relax time, the amount of time this was done, the total treatment time. In here, if you had some kind of ramp up, ramp down, you might want to include that so the person knows how acute this person is and how they're tolerating it and what they need and how to progress them, the total amount of treatment time, and their response to the treatment. And that's a really important, did they have any increased paresthesia, any bowel or bladder issues, any saddle anesthesia? Those are all things that are red flags that we want to treat right away, and we'll talk about that a little bit more in class as far as the emergency situations when you have those bowel or bladder and those saddle anesthesia, that those are emergency room right away. That means that they've put pressure on their cauda equina and they need to get in right away before they become paralyzed. So you really want to make sure you ask that before, during, and after any treatment of the spine. Also, any good responses to treatment, not just adverse responses to treatment. Did it peripheralize their pain? Did it centralize their pain? Did their pain go up or down? Did it change the way they got off the table and be able to put their shoes on? All those different things that we reassess at the end. Okay. So here we're just going to talk about a couple different units that are out there. We don't have most of these. This would be a lumbar unit that works fairly well for somebody. This one is one of my favorites that really works for those patients who have chronic low back pain. It's just kind of a nice, kind of almost myofascial release for them. This is the over-the-door one, which you don't see very often. You can see how that puts pressure on the spine, but for some of your patients who have those really, really compressed necks, they love this. And so just remember you have that as an option for them. This is one we have in our lab, so that you guys will be able to try that one out. It's very comfortable. This also is a very comfortable one. I don't find that this one separates as well as this one for me, but they're both really relaxing. Here's some self-traction positional advantages that people can do because you don't have equipment necessary. It's convenient and they're in control. So you'll see patients do this not even knowing, like when they're trying to unweight themselves a little bit, right? And this is somebody who is doing it on a bar at the gym just to kind of unload for a certain amount of time. The disadvantages of it is it's a low force. You need some good upper body strength and endurance, good upper extremity mobility, and it doesn't have the evidence-based research out there yet. But a lot of patients, this works really well for. So this is that real heavy band like Professor Sanders shows us. He's just doing some self-positional traction. She's doing some just leaning away from her side to kind of get some traction of the cervical spine a little bit. This is really comfortable. A lot of times people will do this just unload at work. It's a nice way to teach them when they've been sitting for a long time just to get up and do this for a little bit, or at the counter and the lunchroom. Works pretty effectively, and like I said, it's inexpensive. Positional traction actually works really, really well as far as for the lumbar spine. So the next slide I'm going to go into a little bit more specifically with you, and you can see if you were you could peel away the muscles of the spine. You can see right in here how this is opening this area up here for this patient, and so this is where their compression was at. Is going to take some of that compression away. So this is really nice for that patient for home, to put them in for a few minutes at a time to relieve areas where they might be having some compression after they've been on their feet or they've been sitting for a long time. So here you can see you put the towel roll to adjust how much you want to gap that area, and you're going to put it under the area where you're wanting that to gap. You're going to rotate the upper body segment until you get to where you want that isolated out, and then you're just going to bend the hip up until you feel that targeted area. So once you've done this in the clinic, you can have the patient kind of replicate that at home. I just tell them to play around a little bit with bending their knee up and down a little bit so they feel that relief, and same thing with their upper thoracic spine a little bit. And I always have them hook their foot right here. And then they just kind of stay in that position for about 5 minutes, as long as it's relieving their pain. And then they come back to supine, and I have them do a few other little exercises before they get up. And they can go back and do this as many times as possible. It's a very effective tool. So the advantages of manual traction, we're going to do that on the next slide. Okay.